Dr. Sattik Siddhant, a consultant endocrinologist and diabetologist of Kolkata. Hope all of you are doing fine at this time of COVID-19 epidemic. Yes, we are going through a very tough time, but I am sure we will definitely overcome in the grief situation. Well, there have been many speculations regarding the connections of COVID-19 with diabetes mellitus. Many patients are extremely worried whether they are more susceptible to this COVID-19 infection or not. I am here today to primarily discuss about the myths and facts and all the necessary precautions that needs to be adopted to all the diabetic patients to follow and to keep the blood sugar levels at control, particularly during this current lockdown period. At the very outset, it needs to be emphasized that diabetes is an immunocompromised state. And like any other immunocompromised state, like chronic kidney bronchial asthma or chronic obstructive pulmonary disease, they are prone to infection. But that does not mean that diabetics are more prone to infection. But once they are infected, they usually run a bad hospitalization course, like increased frequency of hospitalization, increased comorbidities, increased necessity of ICU admissions, increased intubation, increased mortality, and thereby morbidity. So one must know the primary goal of any diabetic patient is to keep their blood sugar levels at control. But one must not panic in this situation. One must stay calm because stress and anxiety causes severe perturbations of glycemic levels, resulting in poor glycemic control. Check your blood glucose regularly. I can feel that most of the diagnostic labs are now closed. So keep a functional glucometer in hand with adequate glucose strips and measure the blood sugar levels periodically at regular intervals, say suppose twice weekly. During the lockdown period, many are not motivated to exercise, particularly the gyms are closed or they can go outside for their regular morning walk, but they have to continue the lifestyle modification in the form of diet and exercise. During this free time, one may be provoked for binge eating, but one must refrain from this binge eating, avoid calorie dense, nutrient poor foods, rather stuff your food with plenty of calorie poor but nutrient rich food, plenty of dark green leafy vegetables and yellow citrus foods. Banish your salt shaker from the dining table, have plenty of fluids, avoid carbonated drinks as well as the sweeteners. Also, one must adopt exercise. Exercise must be done regularly. Yes, I can admit the gyms are closed. One cannot go to the swimming or the regular morning walk, but they can walk at your home, in your home, in your terrace, in your veranda. One can do some freehand exercises, jogging, running, simple freehand exercises, meditation, skipping. These can do wonders, including breathing exercises. This can, because exercise increases the insulin sensitivity, it releases chemicals like endorphins, which makes us feel good. One of the important facets is have an adequate sleep. 7 hours of adequate sleep. Avoid stress and anxiety. Limit your screen time. Avoid watching the news in the electronic and the print media that can make you more apprehensive. Avoid using mobiles because it reduces the exposure to blue light on the retina, which may disrupt your sleep quality and increases sleep latency. Take a break from your gloomy breaking news. Rather involve more in some jolly walks like gardening, like solving crosswords, puzzle, engaging yourselves in art, craft, elocution, or recitation, whichever you like. Engage in some quality family time. If you are addicted to tobacco, this is a high time, or ethanol, this is high time to restrict or refrain from using tobacco or ethanol. I would like to wind off by giving up a small suggestion. Have a positive frame of mind. Do not be pessimistic in this difficult time. Try to adopt a healthy lifestyle, particularly in the form of diet and regular physical exercise. Follow all the precautionary measures that are adopted by the government and that has been repeatedly being circulated in electronic and print media and being told by your medical practitioners. That is, use proper hand hygiene. If sanitizers are not available, then simple lukewarm water or water with soap to cover your face and nose. Maintain a proper cough or sneezing etiquette. Practice social distancing, but that does not mean a mental distancing from others. Remember, stay at home, stay healthy, stay positive. We shall definitely overcome the gloomy situation. Thank you.